COVID's grip on Sydney has grown so tight that desperate families are taking relatives to hospital when they're already dead. This is the grim reality on the front line of this emergency. Health officials are also increasingly concerned about last weekend's mass rally in the CBD. Someone who was turned around from the protest has now tested positive, and there are fears there could be more cases. There are 170 new infections. The sources of more than half of these are still a mystery. Despite the Premier's pleas, 42 people were out and about while infectious. Authorities now hope new rules in the city's hotspots will help improve the numbers.
What a day to be outdoors. But in Sydney's hotspots, it can only be enjoyed from behind a mask.
I understand in a confined area or where people are actually close together, but yeah, on your own, I don't get that.
Using the masks outside sucks, but it has to be done.
The mask mandate's only exemptions are during vigorous exercise and in vehicles. The rules are tough, but the Premier insists they're necessary.
This Delta strain is contagious, it's deadly, and it's affecting people of all ages.
Signs of COVID are everywhere. Even in the east, police are out in force. And they're preparing for the possibility of another protest tomorrow.
It's really sad, shocking. I can't believe it. It's insane that people think that way.
I'm in two minds about it. I agree that, we need to, have a voice, but I just don't think the timing's right, especially with numbers so high.
To avoid a repeat of this, 1,000 officers will guard the CBD.
If you think you can splinter from that and protest somewhere else in Greater Sydney, that force will be mobile and will be waiting for you.
Your actions will hurt. Forget about the rest of us, but you could be taking the disease home. Do not give those you love the most a death sentence.
A man who was turned away and fined has since tested positive.
We're just currently working with police operationally to locate that person and determine whether they actually did subsequently attend the protest.
What's also worrying is some people are suffering in silence at home. Health officials are pleading with them to go to hospital before it's too late.
We are seeing more families coming in with a family member who is presenting not alive but dead.
I just want to reassure the community that you will be treated with dignity and respect.
An emphatic plea to ensure people get the care they need. Kathleen Calderwood, ABC News, Sydney.
And Kathleen Calderwood is outside Blacktown Hospital tonight. Kathleen, the health system is coming under increasing pressure.
Jeremy, from Monday, all non-urgent elective surgeries will be postponed at Sydney hospitals. Now, this doesn't include the Illawarra and the Central Coast, and emergency and urgent elective surgeries will still go ahead. Impacted patients should be contacted by their doctor, and they're encouraged to speak up if their health deteriorates. Now, this is another escalation of the lockdown designed to take pressure off the health system, but the Australian Medical Association wants even stronger action. They'd like to see those stricter rules currently in place only in West and Southwestern Sydney to be enforced across the entire city.
Kathleen Calderwood reporting. In Sydney, young people are answering the call to arms. Many are lining up at GP clinics, pharmacies and state-run hubs for their AstraZeneca jab.
Tradie Toby Dunwell is in his 30s and sees AstraZeneca as a ticket to get back on site.
Eventually, I think you're going to have to get it done so you can work.
Negative talk about the jab at work has actually had the opposite effect.
I think talking to those conspiracy theorists motivated me to go get it and not sit on the fence.
We're seeing a lot more people who are very willing to get the vaccines because they're seeing the horrors of what can happen in their community.
Local doctors say more under 40 are requesting AstraZeneca.
Over the last 2 weeks or so, the demand from the public has increased.
I think young people just want to get on with life as well.
Half the daily shots at this pharmacy are going into the arms of young people.
They're loving it to get vaccinated because they just feel they are protecting themselves and protecting their parents or their elderly people.
The state is a third of the way to its target of 10 million doses.
Come on, Greater Sydney. I'm calling upon everybody to come forward and get vaccinated.
The Premier's also calling for the federal government to deliver more vaccines, pushing for the state's full allocation to be brought forward.
If the vaccines are available in Australia, we need to get them into arms, not at a kind of organised pace, but with a sense of urgency.
It's a call echoed by GPs, eager for more doses.
We're booked out, we can't keep up with the demand.
About 20,000 Year 12 students from Sydney's hotspots will receive Pfizer at this new hub, but the Australian Medical Association opposes the plan.
I understand the concern about Year 12, the importance of HSC, but at the end of the day, Sydney is in an unprecedented crisis, and not only is the future of Sydney at risk, but the future of the country is at risk.
An uncertain future that hangs on vaccination. Tim Swanston, ABC News, Sydney.
Hundreds of troops are tonight preparing to help enforce Sydney's lockdown. The decision to call in the Defence Force has upset some communities.
A military response to a health emergency. Its history repeating itself, but the challenges are different.
I want the presence of the Australian Defence Force personnel to be a message of reassurance to those in New South Wales.
I think it's an extreme measure and not a good look, especially when they're coming in on communities that come from refugee backgrounds.
When Sydney entered its first lockdown, it was mainly inner city areas that were targeted. From Monday, 300 troops are being deployed, most in the west and southwest, where the virus is rapidly spreading.
We'll be working with Multicultural New South Wales. Our multicultural liaison officers will be talking to communities.
With thousands ordered to self-isolate, soldiers will be knocking on doors, making sure they're home.
I think this is very good. Very good for everyone, very safe for all the people.
It's unusual. Soldiers should be somewhere where there's trouble, not in the community.
We have to make sure that everyone feels safe and secure.
But some say it could be an unsettling sight for refugees who fled war-torn countries.
Instead of deploying the military, instead of deploying the police, let's deploy some multicultural, multilingual health officers, because this is a health crisis, not a military crisis.
Officers admit they're stretched and calling in the military is a last resort. Much like natural disasters, soldiers will be providing a support role, and it's up to police to call the shots. Troops will be moved around as new hotspots emerge. Mark Reddy, ABC News, Sydney.